Hi friends, good evening. I'm Dr. Ashutosh Gupta, and now let us talk about the hypoplastic nasal bone, right? Okay. So we need to try to understand that the premise of this prenatal diagnosis or a fetal medicine consult is all about the hypoplastic or an absent nasal bone, right? Okay. It is not exclusively about Down syndrome. So meaning thereby that there could be two clinical situations that probably we need to identify them two as separate, meaning thereby that we have done some code double marker or we have done some codable marker, or could be in family history of Down syndrome. In those cases, the NIPT works wonderfully well. Right now, the premise is this that on ultrasound we have identified that there is some issues regarding the nasal bone. Okay, so nasal bone could be absent or could be hypoplastic. So we do have those nomograms available for all those things. So I'm not getting into the details of it, right? Okay. So now let us talk about whenever we identify that there is some issues regarding the nasal bone, right? So this could be absent or could be hypoplastic. So meaning thereby जो premise है जो जिस चीज को हम ढूंढ रहे हैं whatever we are trying to identify, whatever the answers that we are trying to identify, the questions are the question is about the nasal bone. Okay, so to give you the right perspective, even though we identify that this is an absent nasal bone, we forgot about the hypoplastic. If we think about that it is an absent nasal bone, the Down syndrome would happen in only 18 to 33% at max. So meaning thereby that if we take the higher upper range of 33% to be trisomy 21 or to be Down syndrome, wherever we are identifying the absent nasal bone, so you would imagine that in two-thirds of the cases, meaning thereby 65 to 70% of the cases, the etiology is something else. So you cannot identify them to be normal, right? We cannot say that it is not Down syndrome, so it is normal, right? Okay, so there could be a lot of etiologies across. So probably we need to increase the armamentarium, increase our overview so as to diagnose other things across, which is leading to this some issues regarding the hypoplastic nasal bone. You got my point? So let me go through those slides and probably I'll try to make you understand, and then probably we'll talk about and then we'll decipher. So this is the etiology for hypoplastic nasal bone, starting from skeletal dysplasias. So we can have this skeletal dysplasias across, and then we can have some sort of an environmental influences also, starting from infection, and then you can have fetal alcohol syndrome, and then you can have some chromosomal defects in which we can have the microdeletions, and then we can enumerate those microdeletions. So we need to do a battery of tests so as to identify all of them. So as we have gone through that list, which can lead to this hypoplastic nasal bone, we can have some skeletal dysplasias, starting from osteogenesis imperfecta to thanatophoric to diastophoric to campomelic to something else, right? So probably we need to have very strong sort of a measurements regarding the long bones and to have the limbs, and then to see for the polydactyly and to see for the chest, right? And then we can have some environmental influences also. So starting from infection to warfarin deficiency to vitamin A deficiency to diabetes to oligohydramnios to a lot of things across. And then we can have Down syndrome, plus we can have some microdeletions also, right? And those microdeletions can also be there which would look like Down syndrome or which would have an hypoplastic nasal bone. So meaning thereby that starting that exclusively looking around only for Down syndrome is not going to solve our problems. So probably we need to look around for the etiologies that have a Down syndrome like faces, right? So whenever we are dealing with hypoplastic nasal bone, so probably we have to increase our overview and we have to look wider and so as to see the etiologies which they look like Down syndrome, and then probably we would be in a position to identify all of the etiologies to it. Once we those etiologies जब differential diagnosis ही हमारे different होंगे, then probably to target those differential diagnosis definitely we would seek for more investigations to be done apart from looking around only from NIPT. So NIPT works wonderfully well only for Down syndrome, but I do have another video in which we'll talk about those microdeletions, and so the fetal fraction greater than 4%, it works wonderfully well only for common aneuploidies. So meaning thereby the Down syndrome is being ruled out, but then that is also very basic. So meaning thereby that mosaic Down syndromes and Robertsonian Down syndromes are not being picked up by the common offered NIPT, right? So once we know that there could be a lot of differential diagnosis leading to hypoplastic nasal bone, so probably we need to increase our armamentarium by doing the amniotic fluid karyotype to CMAs to the whole exome sequencings and to do a NGS so as to look around, and then we need to do a very highly dedicated ultrasound so as to see and to identify the other sort of an ultrasound findings with the nasal bone, right? So that might give us some lead where exactly are we leading into, whether it is infection or warfarin or diabetes or skeletal dysplasias or mild micromedias, hypophosphatasias, and so on and so forth, right? So hope this sort of settles out the hypoplastic nasal bone thing, right? Thank you very much for your patience.